Welcome to the staff meeting at Marina Hills Animal Hospital. Today we're going to talk about pets that urinate inappropriately. It's common, it happens. Sometimes pets that are urinating inappropriately are drinking a lot of water, and because they're drinking so much water, they're urinating all the time, when they're supposed to, when they're not supposed to. And in that situation, we do blood work primarily to look for changes with their kidneys and their endocrine systems, because sometimes hormone imbalances lead to excessive water consumption, like diabetes, like Cushing's, and some rare conditions like diabetes insipidus. Sometimes when pets are urinating inappropriately, it's because they are leaking urine. These are typically dogs who lay down, they get up, and there's a puddle left behind in their bedding. And that's a whole different cluster of pets, most often seen in older spayed females and often controlled with medication. But sometimes pets are urinating inappropriately because their bladder hurts, and this is actually the most common. When dogs or cats have a painful bladder, it can be caused by bacteria, it can be caused by crystals, which are acting like a pumice, irritating the lining of the bladder and urethra, or the discomfort can be caused by tumors in the wall. That's rare but possible. Sometimes we look and look and look, we can't find the cause, and so we call it idiopathic cystitis, which means your bladder hurts and we don't know why. But the thing I wanted to focus on today is the occasion when crystals glump together and form stones. And this can happen to dogs or cats. Stones are physical things. You can hold them in your hand. They roll around inside the bladder, causing discomfort. Beyond the discomfort they cause, there's a chance that they can cause obstruction. If the stone tries to leave the bladder and get stuck in the urethra, that goes from an irritating situation to a life-threatening situation in about 24 hours. Because if you cannot urinate, then your kidneys will shut down, and then your potassium will go up, and then you will die. And so while bladder pain is annoying and frustrating for pets and people, bladder obstruction is life-threatening. It needs to be identified and treated pronto. Obstruction of the urethra happens most often in males because their urethra gets small on the way out, but it can happen in females as well. We've actually seen that a couple times. The way that we work these pets up, of course, we start with a thorough history to find out, are they drinking a lot, are they leaking, are they posturing? If we hone in on a pet with a painful bladder, we often will do a urinalysis first, because we want to see, is there blood, is there infection, are there crystals? If we don't find those things and our pets are still painful, that's when we do imaging to look for stones. The imaging, x-rays are very good at showing most stones. There are some stones that don't show up on x-rays. Ultrasound is very good at finding masses in the wall of the bladder and thickening of the bladder, and also can find stones as well. And so we often will combine both x-rays and ultrasound to get a thorough picture of if there's masses or stones in the bladder. On the occasion when there's stones in the bladder, our goal is to get them out, because by removing them, the pets feel best quickest. Sometimes, particularly in female dogs, we can sedate them, anesthetize them. Dogs usually walk around on all fours. If we stand them up while they're sedated, if you express their bladder, sometimes out comes a stone. And that's a good day, because if we can avoid surgery, we'd sure like to avoid surgery. But if that's not working, we need to be prepared to go right into surgery, which we typically do. It's pretty straightforward to remove stones from the bladder. It's an abdominal surgery. Veterinarians are very familiar with this, not a high complication rate, and very successful at giving quick relief. The challenge is if the stone is not in the bladder, but if it's in the urethra, particularly in a male dog or cat, if it's stuck in the urethra. Because the stone has to be removed, it is not a good day if we have to do surgery on the urethra itself. It can be done, but it adds a whole level of complication. So our intent, if we can't get the stone to just come out of the pet when they're anesthetized, is to get the stone to go back into the bladder, so that we're doing bladder surgery, not urethra surgery. And very often when they are anesthetized and relaxed, and we use catheters, and we use hydropulsion, we're using saline to force fluid retrograde not the way it would normally come, but back upstream, we can often get the stones to move into the bladder and do bladder surgery. If we have to, we can and will do surgery on the urethra. And depending on the pet, that is difficult or very difficult, depending on where it's located. But that's what we do. And of course, we just had a patient where we just did that yesterday. That's what brought this up. Any questions? Great, thanks for coming.